Assalamualaikum and a very good day to everyone. The title of our lecture for today is School Oral Health Program. At the end of the lecture, all of you should be able to describe the School Oral Health Program, its objectives and advantages, outline School Oral Health Program in Malaysia, be able to differentiate between incremental and comprehensive care, be able to outline the strategies of WHO Global School Health Initiative. Business of oral health. It is a known fact that oral health is fundamental to general health and well-being. Now, good oral health will bring about an improvement to overall health, leading to an enhanced quality of life. Oral health is a valued asset. It contributes to a person's social, mental, and physical well-being and enhanced quality of life. Why is oral health important? Poor oral health can have a detrimental effect on children's performance in school and success in later life. And children with poor oral health, on average, is 12 times more likely to have restricted activity days, including missing schools, as compared to those who do not. And amongst other conditions, it was found that tooth decay and gum disease are the two most prevalent oral diseases among children. And premature loss of teeth may lead to sequelae like malalignment, impact on appearance, poor nutrition which can affect their growth and development. The effects of oral health will include poor oral health that will affect learning, general health and well-being. Poor nutrition because people with no teeth have difficulty eating. Speech impairments as teeth is important in pronunciation and phonetics. It will also lead to psychological problems. For example, people with no teeth tend to feel inferior and has limitation in socialization. Other effects would be cardiovascular disease, diabetes, and cancer. Now, why do we focus through schools? Schools in an ideal setting, as about 80% of children attend primary school and about 60% of them attend secondary school. Therefore, a school is a setting whereby we can reach to about 1 billion children globally. And at this stage, the children are moldable and can easily be influenced. It will lead to a long-lasting and sustainable oral health behavior may be developed at this stage. There is an earlier opportunity of intervention. Cost is much cheaper and easier to reinforce. Now, in schools, there is a supportive environment. For example, there is provision of water and sanitation, which are both quite essential in activities like toothbrushing. And school can be the only place to have access to oral health services, especially for the high-risk groups. And school also can provide an important link to the community and such as important network and channel to the local community. School also is a less threatening environment because it is an environment very much familiar to the children. Now let's look at the elements or components of school oral health program. Number one is improving school-community relations. One of the first steps in organizing a school oral health program is to form an advisory committee. Now, this advisory committee, sometimes also known as organizing committee, should include parents, teachers, school administrators, dental professionals, health officers, and community leaders. Amongst their tasks would be to appraise and publicize dental needs of school children, to address the school administration's concern in the promotion of oral health, and to make people realize the importance of oral health. Secondly is conducting dental inspections. Now, in this case, there are pros and cons. If, for example, an extent of dental caries amongst the school children is known, example 95% or more, then it is a debate whether we should do screening or not, because it could be a waste of resources. But those in favor suggest that conducting dental inspections can be important because it serves as a basis for school oral health instruction. It can provide motivation to children for better oral health. It can provide baseline and cumulative data for further evaluation, and it also provides status of oral health needs for planning of dental health program. Number 3 is conducting dental health education. School is a favorable place for us to conduct dental health education. But we should include a suggested formal approach to teaching dental health in the classroom. Now, dentists may serve as the expert resource person to strengthen the instruction given by teachers. Now, it is very important that the teachers have proper attitudes and personal dental health practices, because it can then be passed on to the children. Now, availability of dental health education kits at school is a plus point and is an advantage. Fourth is performing specific programs. Now, school is an ideal place to perform specific program based on needs, such as toothbrushing program, classroom-based fluoride program, for example, fluoride mouth rinses, fluoride tablets, or school water fluoridation program. And they may also include nutrition as part of school preventive dentistry program, for example, in doing a school lunch program. Now, sealant placement is also a program that can be put in place where it is indicated. Conducting science fairs, and this can be held as a standalone activity or in combination with other activities that are carried out in school. Science fairs can help in educating and motivating school children to improve their oral health. Now, referral for dental care. Some schools do provide dental care, but in case if only emergency treatment is provided, referral should be made to the dentist with structured referral system in place. In some schools, blanket referral is used. However, this is not implemented in Malaysia. Now, in this case, referral cards are given to the children to take home, and family dentists will sign on the card after completion of examination, treatment, or both. And the children will then give the signed card or return the signed card to the teachers or school nurse, who has very important role to follow up the referral. Now, for follow-up, a good follow-up system is required. And this is usually handled by dental therapists who will conduct follow-up examination. Now, the advantage of a school oral health program, number 1, it is less threatening than if we compare it to the private clinic, because school is a more familiar surrounding to the children. In schools, it also permits health education, and a school clinic can actually tackle simple needs and saving the complex problems to the specialized services. And apart from referral to the dentist in the government, efficient method of referral is also available or readily made to the private care. School is an ideal setting for auxiliary use. Therefore, it can further reduce the cost of providing oral health care. It is also an opportunity to young dentists, and school oral health program is also peer-reviewed, therefore standard can be maintained. Various healthcare are also provided in schools, and thus integration with medical facilities are also possible. Now, let us see what incremental dental care is all about. In short, it is called IDC. Now, according to Dunning, IDC is defined as periodic care so spaced that increments of dental diseases are treated at the earliest time consistent with proper diagnosis and operating efficiency in such a way that there is no accumulation of oral health needs beyond the minimum. There are a few keywords here that I would like you to underline and understand. Now, the first one is the word increment. Then at the earliest time, and accumulation of oral health needs beyond the minimum. Right? In other words, the dental diseases are being treated early, and it is timely, and at the same time it does not go beyond the minimum. Now, the interval between the visits is usually between 6 months to 1 year. Now, what are the advantages of incremental dental care? Okay, number one, the lesions of dental caries are treated before there is a chance of even pulpal involvement. And likewise, periodontal disease is also able to be intercepted much earlier. Topical and other preventive measures are maintained on a periodic basis, and bills for dental services are equalized and regularly spaced. Now, the program avoids high expenditure of late dental care by confining dental diseases to small early increments and therefore reducing the loss of teeth. Because of regular follow-up intervals, it inculcates a habit of periodic turn to the dental office in subsequent years. Well, the disadvantages of IDC would include number one, time consuming. As we know, restorative dentistry is more time consuming if done on a piecemeal basis rather than a wholesale basis, because operative program can be handled quite easily on a quadrant basis under local anesthesia instead. Attention to deciduous teeth may lead to permanent teeth to be neglected, and at the end of the day, we might find that the financial resources may be exhausted on deciduous teeth, and the permanent teeth might receive no care at all. Now, mobility of children and families tends to interrupt the progress for dental and or maintenance care. So this could be a problem if there is interruption in the children's dental health program. Now let's compare between the two. What is the difference between IDC and comprehensive care? So basically, IDC is providing oral health care that doesn't go beyond the minimum, which means not only it is done timely, incrementally, and at the same time only providing oral health care that is required or needed. While the comprehensive dental care provides the full range of oral health services from diagnosis, treatment, follow-up, and rehabilitation of patients. In summary, the incremental dental care is can be spaced, so increments of dental disease are treated at the earliest time, whereas in the comprehensive dental care, the periodic care are placed on a mid-year basis. Incremental dental care can be done timely where no accumulation of oral health needs beyond the minimum, where in comprehensive dental care, it will provide a full range of oral health services. It is very much economical when doing under the incremental dental care and can be expensive if it's providing comprehensive dental care. Incremental dental care is normally an individual work, while the comprehensive dental care is more of an organizational work, probably involving different specialities. Okay, let's look at the school oral health program in Malaysia. Oral health program, Ministry of Health is the lead agency in the provision of oral health care services and the development of legislation concerning oral health care in Malaysia. Together with MDC, it is the regulating body where policies concerning oral health care are developed. Now, with more than 40% of the Malaysian population below 18 years old, oral health care for school children continues to be a priority until to this day. Initially, school children were made the only priority group. However, later it was to be included the preschool children, antenatal mothers, special needs children, elderly and adults. Okay, there is no formalized structure program for school children provided by the private sector. Oral health service in the private sector is based on demand and provided on a fee for service basis, and this is true also for children. Now, the type of treatment provided by the private dental practitioners is geared towards catering to the needs of the individual patient, and follow-up of patient may be possible, but compliance by patient in the private sector is known to be poor. National Oral Health Plan goals for 2020 focuses much on school children. I will just give an example of the three important indicators regarding school children. Number one is the percentage of 6-year-old school children with caries-free mouth with a goal of 50%, and in 2015 the achievement was 36.0%. The second indicator is the percentage of 12-year-old school children with caries-free status with a goal of 70% and achievement of only 42.6%. Percentage of 16-year-old school children with caries-free status with a goal of 50% and an achievement of 56.0%. So from this, it can be seen that goals for two indicators have not been achieved. So this further indicates the need to put emphasis on primary school children. Now, government dental service begins as a school dental service following very much that of school dental service New Zealand style. Now, the school dental service is the core of oral health service and is focused to ensure coverage of all school children. Incremental dental care was introduced in 1985 to ensure a systematic and comprehensive care, and this comprehensive care comprises of promotive, preventive and curative services, which are delivered through an incremental approach which focus on prevention, early detection and control of oral diseases. A guideline for oral health care for school children was published in 1997 by the Oral Health Program with the purpose of streamlining activities for school program in the country, as well as to document the incremental dental care procedure. Let's look at the dental programs in school. There are various delivery modes that constitutes dental program in school. Number one is the school dental service, which is the core program. Then we have the school health education curriculum, which was developed to ensure consistent and the right messages are delivered. Then we also have the dental health education programs for trainee teachers, outreach initiatives, service for children with special needs, preschool services, Fissure Sealant program, toothbrushing programs, which is very widespread, and blanket referral. However, blanket referral is not being practiced in Malaysia. In specific, let's look at the school dental service. Because in Malaysia, the school oral health program is better known as the school dental service. Okay, incremental school dental service in Malaysia is focused to ensure coverage of all school children. For example, in 2016, the coverage of primary schools is 97.3%, while that of secondary school is 86.7%. While the coverage in 2017 for primary schools is 99.2% and secondary schools 83.6%. The incremental approach involved a few activities such as dental screening, oral health education, toothbrushing drill, clinical prevention, and curative. Okay, the ultimate objective of school dental service is to achieve and maintain optimal oral health among school children. In order to get there, several specific objectives are drawn up as follows. To render oral fitness amongst all school children who have received treatment, to strengthen clinical preventive initiatives among school children, to enhance continuous professional development of oral health care providers, to enhance the roles of teachers, parents, and community in oral health promotion, and lastly, to empower school children in taking responsibility of their oral health. What is meant by oral fitness? Oral fitness means to be free from active oral diseases, and they are often measured by the following indicators. Caries-free, TFX equals to 0 for 6-year-olds, DMFX equals to 0 for 12-year-olds, percentage of no treatment required for 16-year-olds, percentage of case completion, and percentage of gingivitis free. This is to measure specifically for good oral hygiene. Scope of school dental services are as follows. Annual oral health examination or dental screening, provision of comprehensive care, but in this case, comprehensive care means to give emphasis to the preventive services such as toothbrush drill, sealant fissure, and topical fluoride application. Followed by patient education, which is providing dental health education, and comprehensive care here encompasses promotion, preventive, and curative services. Delivery of school dental service is conducted in 3 ways, namely via mobile dental teams, mobile dental clinics, and school dental clinic. Except for school dental clinic, the mobile dental teams and mobile dental clinics are delivered as an outreach program. Okay, under the mobile dental team, the oral health personnel sometimes travel to school by land or river. More commonly nowadays, they also cover schools in urban areas. Now, in this case, a temporary clinic is set up using appropriate equipment such as portable autoclaves and portable dental units, and the school will provide suitable room for this purpose. The team that goes to these schools comprises of dental officers, who is the team leader, dental therapists, dental surgery assistants, dental attendants, and drivers. Once they have completed one school, they will move on to the next school. So this is done on a rotation basis. Mobile dental clinic serves to deliver oral health care to rural and urban schools. Now, under the 7th Malaysia Plan, many of the old mobile dental clinics were replaced. We have got several types of mobile dental clinics available. Mobile dental clinic which is attached to a prime mover. These are the earlier version. Nowadays, it is more common to see mobile dental clinic in the form of buses or vans. Now, the clinic houses 1 or 2 dental chairs and is air conditioned and equipped depending on the availability of space. School dental clinic was established in the school in 1970s, and it is usually planned for schools with large enrollment exceeding 1,000 children. The school will provide a room. Depending on the space available, the room may be equipped with 1 or 2 dental chairs and other necessary equipment. One of the main advantages of providing service in school is the proper infection control environment. And the team that usually is available in the school dental clinic comprises of dental therapist, who is the team leader, dental attendant, and driver. Let's look at a few specific programs that is being conducted under the School Oral Health Program, or in Malaysia better known as the School Dental Service. Toothbrushing program is one of the specific program delivered. In this program, school children are also taught hands-on on the proper way of brushing teeth through toothbrushing drills. These toothbrushing drills, also known as latihan memberus gigi, in short LMG. So LMG can also be carried out by schools on a daily or weekly basis, depending on the school. However, we would advocate on a daily basis. It can be done without supervision of oral health personnel after the teachers in the school have been trained. Now, the National Oral Health Survey for School Children 1997 reported that more than 70% of dental caries affected the molars. Now, this was one of the reasons why the Oral Health Program, Ministry of Health, started the school-based Fissure Sealant program. Because in the same survey, it was also reported that occlusal surfaces as being about 4 times more carie susceptible than other surfaces. Subsequently, guidelines were formulated for integrated school-based Fissure Sealant program, and it was implemented in 1999. Now, this program involves a team of dental officers and dental therapists as part of the outreach incremental dental care program. Now, the other program that was launched is the preschool children program, launched in 1984 for kindergartens. Now, this program utilizes a friendly, non-invasive approach where dentistry is introduced to the children via promotional and preventive initiatives. So most of the activities is confined to LMG or toothbrush drill, puppet shows, role play, interactive games, and storytelling, and etc. Whenever it is indicated, ART or atraumatic restorative technique is adopted to provide restorative care. Okay, program for children with special needs was launched in 1993 because the oral health program recognized children with special needs as one of the priority groups. Now, initially, emphasis was given to the disadvantaged group at outpatient clinics, and treatment was given to children at institutions, with the objective of improving their oral health that will contribute to enhanced quality of life, inculcating good oral health practices, and increasing awareness of carers of children with special needs, and also to improve the skill of dental personnel. Okay, initial phase of the program is where emphasis was given to prevention. Slowly, the curative component is added and gradually increased until the provision of complex care. The program for children with special needs requires close cooperation and collaboration from all parties, such as the dental personnel, parents or guardian, institutional personnel, health personnel, and related government agencies. Dental officers and dental therapists are the main providers, and complex cases is referred to the special needs dentistry specialist for further management. Referral for complex care is now made easier with increasing availability of specialist care. For a start, placement of special needs dentistry is throughout the country and is placed according to zone, the northern zone, central zone, southern zone, and eastern zone. The pediatric dental specialists and orthodontists in particular also can play an increasingly important role in the management of complex cases for the special needs children. Here you can see that the dental therapists would be guiding the children and helping them to do the simple toothbrushing. Okay, the next program is the program for trainee teachers. Now, this program has been conducted in almost every state with success. It has the objective of creating awareness and encouraging participation of teachers in oral health promotion, and teachers are supposed to reinforce health messages and encourage good oral health practices among school children. And we believe that with the cooperation of teachers, they can contribute effectively towards oral health care because they are in close contact with the children, and indirectly they can create the children to have dental knowledge and positive attitudes and practices towards oral health. Now, strategies for implementation under the school dental service. Several strategies are adopted. Number one, as we already know, is the comprehensive oral health care for school children, which covers from primary 1 to form 5. And strengthening the referral system to dental officers and specialists, strengthening the clinical prevention initiatives, expansion of outreach initiatives to increase coverage, enhancing the role of parents, teachers, community, and other agencies, enhancing continuous professional development of oral health care providers. Now, these are the types of facilities available and continuously being updated based on the availability of budget that is under the school dental service. We have the school dental clinic, we have the mobile dental team, and the mobile dental clinic. Now, nowadays, the mobile dental team not only deliver services under the outreach program to preschools, primary and secondary schools, and the special needs children, but it now has been expanded to, or rather extended to the elderly. Now, there is no specific allocation given to the school oral health program or the school dental service. It is incorporated into the overall budget allocation for oral health program, which encompasses other activities such as specialist care, other target groups in primary care, and community and oral health care. In other words, there is no specific budget to just only school dental service. In conclusion, the school oral health program in Malaysia, or the school dental service, where the incremental care approach is being used, it has brought a tremendous increase in the number of school children receiving primary oral health care. That means to say each year the coverage is increased. Now, this initiative has resulted in a marked improvement in the oral health status of school children. With an increasing school-going population, it is a good catchment where good oral health practices and a positive attitude in behavior can be developed in the formative years and remain into adulthood. It is also essential to always for us to consider the relationship between oral health, general health, and quality of life, so that we are constantly reminded on the importance of oral health in keeping a good or improved general health. Now, before we end this lecture, there are a few more slides that I would like to share with you regarding the WHO Global School Health Initiative. Now, this initiative was launched in 1995 and it seeks to mobilize and strengthen the health promotion and education activities at local, national, regional, and global levels. Now, this initiative is designed to improve health of students, school personnel, families, and members of community through school. So through this initiative, it is the beginning of health promoting schools. Now, a health promoting school is one that constantly strengthens its capacity as a healthy setting for living, learning, and working. So it has the following characteristics. It fosters health and learning with all the measures at its disposal, and a health promoting school would engage health education officials, teachers unions, and other parties that may contribute to make the school a healthy place. It strives to provide a healthy environment. It provides school health education, school health services, and along with school or community projects, and all in all is for the support of the school in making it a, a healthy school. It implements policies and practices that respect an individual's well-being and dignity and provide multiple opportunities for success, and at the same time it acknowledges good efforts and intentions as well as personal achievements. In a health promoting school, we understand that the community contributes to either undermines contributes and also whether it undermines health and education. So it is considered to be important if we recognize this. Now, it is evident that for health promoting school initiatives, to be successful, it requires a multi-sectoral approach. And it can be seen that role of dental profession has shifted from that of provider and presenter of dental health lectures to that of initiator, encourager, and supporter of programs that can be used by teachers in school. So we would regard teachers to be an asset, and they can be empowered to help us to create awareness amongst school children and all others involving all others that can be involved in a school, like the parents, the teachers, the community leaders, etc. Now, I hope you will do more reading on this topic by referring to the recommended textbook. And until our next lecture, take care everyone.